it feels like everyone has gut issues right now, from reflux to IBS, food reactions, bloating. What's happening? Like, why do you think all of a sudden, like, just gut health problems are exploding?
Yeah, I think that I personally have seen so much more autoimmune type processes in the gut than I've ever remembered seeing in the past. You really think it boils down to diet, the ultra processed foods, all of the different additives and ingredients that are in our foods these days, along with stress. I think stress has been a really big player in gut health. I think sleep management is an issue for a lot of us, and we'll be, very surprised to understand the relationship between sleep and gut health as well. And so activity, I think, is another big one. A lot of people are busy in their day-to-day jobs. They don't necessarily make time for exercise, and getting the activity level that we need on a weekly basis, I think, is sometimes challenging.
So you like, oh my gosh, like you just throw the blanket over everything. I mean, and that's exactly it. And what's really crazy that I find about that is you didn't really talk about the function of the gut. You talked about all the things that affect the function of the gut. And I think that's pretty amazing. And I think you nailed it. I think it's all those other things that we're missing out on that ultimately play havoc on the gut. And you know as well as me, and especially being a GI doctor, if somebody's gut's not well, like, does that affect everything else? I mean, honestly,
Yeah, absolutely. And I think the thought process has really evolved a lot, and we understand more and more the relationship between gut and brain interactions. And that's become a lot more detailed for us in terms of studies that have been done, and the connection is huge. And so if we're not seeing good gut health, then we're definitely not seeing good mental health. And, I think even on the level of mental health, anxiety disorders, ADHD, all these other things have really emerged. Especially in our young populations, I think we're seeing a lot more of this. And this really goes back to, could there be something in the gut that's affecting all of
and so you just held something else. You may be the best doctor somebody goes to when they have anxiety and depression, because a lot of that, I will tell you, we see that all the time. And you mentioned immune system in the gut. When that gets out of balance, that has such a dramatic effect on people's brain health. And so that's kind of an interesting take that over time, do you ever see that? Like you start fixing somebody's, that gut, that all of a sudden these other things kind of start fixing themselves?
Absolutely. And that's just scratching the surface, right? Because we haven't even talked about hormone health, and hormone health really is another big problem where your gut disorders may be affecting hormones and vice versa. And so I think that there are a whole bunch of different systems that get affected when gut health goes bad.
So you just brought up something, and that's a great one. And I see you mentioned hormone health. So let's talk about that for a second. Is there a difference of the gut of a lady who's 20 or 30 versus one in perimenopause 30, 40 versus a lady who's 60, 70? Do you see difference in gut health based upon hormone changes that happen throughout a woman's lifespan?
Absolutely. So we very well understand, again, the role of postmenopausal hormone balance and how that affects not only mental health, stress, weight gain postmenopausally, and the distribution of weight gain. So we have a number of patients in our practice who are postmenopausal who don't quite understand what is happening to them.
So that's really, and I didn't think about that. You're right. It's like, what came first, the chicken or the egg? You just mentioned it. If you're saying stress can affect gut health, but if we got hormone imbalance that's making stress worse, it's kind of like a snowball headed to nowhere. Then you wonder why these ladies come in with all these GI gut health issues and everything else. That's great. One of the things that's just out of control right now for me as a pharmacist is people on these GLP-1s, from Ozempic to Mounjaro and all that type of stuff. And we know these drugs work all throughout the body, because you can go do the PubMed search and they're using them for a million different conditions. But one of the biggest places these drugs work is in the gut. What kind of gut issues, good and bad, are you seeing with people on GLP-1s?
Yeah, I think the GLP-1s really have a tremendous role in a variety of different conditions. So, originally we know it for diabetes, of course, and that's where it started. But we have since seen a lot of benefit in other areas as well. So I personally think that they have a really good place in the management of multiple different disorders. And the big thing that we see in addition to weight is fatty liver disease. And so this is where I think we're seeing a lot of benefit, but it's been shown to reduce cardiovascular risk. It's been shown to improve just a bunch of different metabolic disorders. But more interestingly, we're also seeing some impact on it on an inflammatory level. So we deal with a lot of patients who have inflammatory bowel disease, Crohn's or colitis. And we are seeing, because of its action, it does actually have some effect on anti-TNF. So it has an anti-TNF effect. And it really can modulate inflammatory disorders as well.
So yeah, and just so those that don't know, TNF is one of these inflammatory markers. And a lot of times, especially I'm sure in your case, you're monitoring these inflammatory markers because if there's inflammation in the gut, it's not working the way it's supposed to, which we just talked about, affects the whole rest of the body. That can be like I guess you would say the ground zero for a lot of metabolic disorders. So that's a great call out. So in terms of people with GLP-1s, I know one of the things we see a lot is constipation. I guess, and the other thing is, and I knew this because you and I've talked about this before GLP-1s, what's called gastroparesis, or that motility of the gut. Because keep in mind, when you eat food, your body has to carry it along these miles and miles of transit in the gut to get it to the other end. But that's how digestion occurs and all that kind of stuff. But GLP-1s affect that. And I said, and like I said, now everybody's on those. Tell me, do you see gastroparesis issues with people with GLP-1s? And if so, does that typically improve if they get off of them or lower doses? What do you see with that?
Yes, absolutely. So we know that GLPs will affect gastric motility, and that's one of the main ways that GLPs are effective. They do decrease the food noise, they decrease the overeating. And so we're able to really take advantage of the fact that they have an effect on motility. They also regulate insulin production better. So the effect on the stomach, delayed stomach emptying, really, I think can be managed if we approach it the right way. So one thing is to titrate the drug to make sure that we're starting at low levels, and then you're titrating the drug up as patients tolerate it. I also believe that you can do what we call microdosing. So that means that you may take smaller doses more frequently, maybe half dose twice a week rather than one larger dose once a week. And patients generally will tolerate this better and better as they move forward on the dosing schedules. So if you work with them properly, make sure that you've got to counsel them on how they need to change their eating patterns. So they can't eat like they normally eat. They've got to break their meals down into smaller portions, and they need to eat the right balance of food. So we know that different foods have different emptying times. So we know that carbs empty the fastest, and then proteins, and then fats. So if they're eating a very fat-heavy meal, then you may find that they will actually have more of these gastroparetic symptoms.
No, and that's a great call out, because that's part of the challenge is these people don't eat as much, or they eat littler amounts, they eat smaller amounts, but that food choice importance becomes more and more important, I think, once they're on the GLP-1, because they're eating less. And I mean, I know you see that too, as far as that goes.
Really the counseling on the portions of the different foods. So, protein heavy diets tend to be more beneficial. They keep you full longer. They also help build muscle mass, which helps burn calories faster. So there are a lot of benefits to kind of tailoring that diet and restructuring the amounts of the different components, macronutrients.
So I'll ask you this as a GI doctor. You mentioned protein heavy foods, and I'd agree, like that's the missing key, or that's what's critical. People are going to be on a GLP-1. But being there on a GLP-1 and that stomach empty or slowing, do you see people have a little more hard time tolerating protein on a GLP-1 because that digestion is different? I mean, I know it's kind of a goofy question, but I kind of wonder about that. If people are, I don't know, to me, it seems like carbs are typically easier foods to eat if you're nauseated, less GI. I mean, do you see that at all? I'm just curious.
I do see a difference in the types of proteins that people are tolerating. So maybe they're not tolerating red meats as much as they might have previously. So maybe a change in the type of protein that they're ingesting. So, fish, I think, sometimes tends to be a little bit easier. Chicken seems to be better than beef. So I do think that if we look at that, holistically, you can kind of figure out that maybe red meats are a little bit more challenging. And then there are non-meat source proteins that I think people should also think about and focus on. And those tend to be, again, maybe slightly easier to digest. I think they come with their own challenges as well. But in general, I think pushing protein and really getting to that at least 1 gram per kilo of protein intake on a daily basis really seems to be a more beneficial ratio.
Oh, that's good. And that's some great information right there. And I really appreciate that because that is the problem that I see with the GLP-1s with patients, and you can take it from a gut health issue. So kind of when I started out, one of the things I really like about you, you're a board certified gastroenterologist, but you also are willing to look at new science, see what the new data is saying, and integrate some of that in your practice. Can you tell me where did you kind of pick up doing that? I mean, that takes not many practitioners do that. It's easy just to kind of go with the grain and do what you're taught in school and kind of follow whatever. And I'm not saying that like in a bad sense. To me, that's what makes you great. You're board certified, you know all that knowledge, but you're willing to look at some alternative things because I think for some patients, it's the combination of those two. It's that what's called integrative brings like, what kind of got you going down that road?
I think that my training in fellowship really gave me a very good sense of just general GI and gave me a really good foundation for what I do on a daily basis. The struggle is patients who don't fall into the typical patterns or pictures of what we were taught it from a textbook, right? Not every patient is going to be as easy as a single diagnosis. So you have these multiple complex disease processes that coexist in any given patient. And in order to really tackle that, you have to go beyond what you've actually learned and try to put these pieces together. And sometimes the conventional thought process really doesn't do justice to every patient that we see. So what I started seeing somewhere in the middle of my career were patients bringing me all these different testing that I had no idea existed. So they would bring me microbiome testing or micronutrient testing or something that I would have to look at it and say, I have no idea what this is. And it was a little disturbing to see to have to tell a patient that time after time. And so that, I really need to understand what these are. What are these tests? Where are they coming from? What do they actually mean? How could I potentially help a patient better by knowing or having some knowledge of these tests? Because people are really more knowledgeable. They have access to resources. They are in and of themselves very, very knowledgeable about different disease states. Sometimes they come to me and tell me things that I've never heard of. So I think it behooves us to really understand what's the validity of these tests, where can we use them, and not close our minds to it, because I do think patients are going to go and find people who will do this type of testing for them. And I believe that I have a good, toolbox, and I have a good knowledge of GI, good enough that, if they came to me and I did these tests, I could probably make better sense and better use of them. So I would like to be the person who helps guide them through this rather than them trying to find somebody who may or may not understand GI as well.
What you just said is my everyday. Patients are so much more complicated. It isn't, these systems don't operate in silos, and the gut affects the brain affects the nerves affect the muscles. You nailed it. And I think if you don't try to look outside of, once again, that narrow focus of, okay, I only look at the gut, you're going to have a challenge. You mentioned tests. So the way that I see that is, and I'll give you an example. Let's say somebody comes in and does an upper and lower GI and everything looks normal, but they're like, look, I'm telling you, my gut is not normal. Like something's going on. I've got issues. Is that where maybe you'll look at using some of these tests to determine what's going on? How do you use GI function tests kind of in your practice? I'd like to kind of learn a little more.
Yeah.
Just because you're right. Everybody's bringing those in or wanting them nowadays. So how would you use those? Do you think that could be helpful?
Yeah, absolutely. So as you mentioned, there are limitations on conventional testing after you've done an endoscopy and a colonoscopy and a CT scan and an MRI and maybe a gallbladder function test. You're pretty much done, right? And these patients have normal testing. Everything looks good functionally, but there's something else that's driving their symptoms. And this is where you have to think outside of the box and say, okay, what do I have left? And if I only use my conventional knowledge, I think I'm pretty much done with that patient and there's nothing more I can do for them. But now that I have a separate toolbox, a whole other set of tools where I could potentially look at food sensitivities, microbiome testing, is there actually, and the more we understand about the microbiome, we don't know a lot about the microbiome right now. And that's a big limitation for us because the more we see studies about, there's huge interest, of course, in this arena because we do know that the microbiome drives a lot of disease processes. And once we can really hone in on where this is actually coming from, I think we can do a much better job. So the science is going to evolve in the next 10 years. I think we'll have much more personalized medicine as we all are striving for. But I think that, when you have that limitation, that's the time when you think about, okay, could I look at the microbiome? Could I look at, for example, SIBO, which is small intestinal bacterial overgrowth? This was almost unheard of in the general GI world for the last 20 years that I've been practicing, but it's exploded. And so there are so many patients now we can understand better and do a better job with them, because this really drives about 60 to 70% of what we used to call irritable bowel syndrome. We thought this was IBS. We thought it was somebody who had, a problem with stress and anxiety. And that was the driving force for the irritable bowel syndrome. But we now understand that there's a microbiome component to that. And just knowing that, really helped me take care of a lot of patients better, because I could now think, okay, maybe this person has SIBO. This is, all these other tests are looking normal. I need to start thinking about what is in their microbiome. How is that affecting them? And so I think that in and of itself has really helped me a lot. In addition to that, I do use some food sensitivity testings. Of course, I make sure that I've done everything in the general GI arena in terms of evaluating a patient before I just jump to these kinds of tests. But when you're not finding what you're looking for, I think these tests could be immensely helpful. We are probably in the infancy of some of these tests right now. And I think validation of these tests is something we have to prove. Can we get the same result on the same patient if we perform the test multiple times, or are we going to see different results? And this is where I think the improvement of the testing quality and validation of these tests really could help us.
So you mentioned two things there that, like you mentioned, your traditional testing checks structure, function, but there's two things you mentioned: microbiome, which is the gut bugs, and your immune system. And those are the things that I think these tests are kind of good at looking at, or at least pointing you right down the right direction. So as far as that goes, so you mentioned SIBO, and I would agree with you. That's the problem. We'll kind of talk about some drivers of that in a second. But right now, for diagnosing SIBO, what is like the gold standard in the medical community and the GI side? What's the gold standard for determining, yes, you have SIBO? We won't get into all the ins and outs of treating it, but what is the gold standard for determining that? So you're right. I've been dealing with IBS forever. What's the cause? Yeah, that's probably it. How's the best way to find that out?
Yeah, I mean, you can do duodenal aspirates. That means you're taking fluid from the small bowel and evaluating the composition, the bacterial composition of that. But it's much easier to do a breath test, which has become more standardized. So Dr. Pimentel out of Cedars-Sinai has developed a breath test that I think is very well accepted in the GI world. It's called Triospart. And so that's what I use primarily for evaluating somebody that I think has bacterial overgrowth. Sometimes the nuances of interpretation, and of course the management of the SIBO once you find it, determining the type of bacterial overgrowth. Is it hydrogen dominant? Is it methane? Is it hydrogen sulfide? Is it a mix of these different ones? Because that really helps us make sure that the treatment correlates with the findings, because, people can empirically treat for bacterial overgrowth, but if you don't understand exactly what mix of organisms you're dealing with, then your treatment may or may not be effective.
Great. That's great information, because I do think that's one thing that gets overlooked. You're right. A couple of years back, people were like, what is this stuff? But you're right. It's such a driver of gut inflammation and all that. And it's that, people don't understand what that is. It's basically, it's an inordinate amount of non-wanted bacteria that just wreak havoc on the gut. And it's that competition. I always look at it like a war of good and bad in there. And we have too many bad, not enough good, or vice versa, and things like that. And that sets up. So let's talk about one of the things that you mentioned a while ago that I do think sometimes can drive SIBO, and that's PPI use because of the effect on the gut as far as that goes. like you said, I'm not gonna lie, on my social media, I'm kind of ruthless when it comes to PPIs just because they're over the counter now. I see people on, we fill prescriptions for people for years for PPIs. And I realize there's a place for them. But I think we mentioned earlier, misuse. Give me your thoughts on PPI use, when it should be, when it shouldn't be. What do you see what are your thoughts on that as a GI doctor?
Yeah. I think that they are very commonly used and they're commonly misused because either people are taking them over the counter and not getting evaluated properly, and they may have a serious condition that doesn't just get better with continued PPI use. And you need to understand why they're using these medicines. The other thing that often happens is they get stuck on a PPI by somebody years ago, and then they never stop it because they've never been reevaluated. And, patients may or may not think to themselves, why am I taking this medicine? So I think that it's on us as providers to make sure that we understand why they're using these medicines. What benefit are they gaining from it? Is there really a need for ongoing use? And there are definitely conditions, for example, Barrett's esophagus, where the gold standard of therapy is ongoing PPI use. And in that individual, you do not want to take them off of it because then they're deviating from standard of care. But then there are others who you ask them, why are you on this? And they're like, I don't know. Somebody told me to take it. And that's a situation where you really have to understand, is there really a need for it? And if not, I generally try to get patients off of these medicines because one, they're not necessary. And number two, they may impose some adverse side effects. Are we decreasing nutrient absorption in these patients? Are we potentially creating a microbiome, disorder where you're now getting an overgrowth of bacteria that are not ideal? So if you're disrupting the microbiome or you're reducing nutrient absorption, it's really time to stop these medicines if you can get them off of it. Now, this sometimes can be challenging because they've been on these for years at a time, and you can't just take them off of it. They will get an acid surge. They'll get rebound acid. And then they'll feel miserable, and then they'll feel like they have to go right back on the medicine. So you really have to do it in a very controlled manner. Sometimes you have to reduce it very gradually. I've even had patients where we've had to open the capsule and take beads, a certain number of beads, to get them off of it. So really, it does take some time and effort to counsel these patients. Sometimes it's easier to just let them keep taking it, but I don't think that's the right way to approach this. It is good to get patients off of medicines that they do not need to take.
Yeah, and that's great. I think that's the part people miss. I think, I'm just cutting off stomach acid and just minimizing reflux. But you're right, that long-term, so many minerals like magnesium and B12, calcium, zinc, but then also too, your body needs that stomach acid to break down protein. We talked about the importance of protein. You're seeing that more and more pushed in diets. And you're right, it isn't easy to get off. And that's a problem is do not cold turkey them. Don't do this on your own. Work with your doctor. But there are strategies out there that you can do to work yourself off of these. And I like that even as a GI doctor, you consider that and look at that and evaluate it. So we started early on. You mentioned all of these things that affect gut. You mentioned sleep, you mentioned stress, you mentioned diet, you mentioned exercise. One of the things that I think all of those drive that gets missed that messes with the immune system is something called leaky gut. I remember talking to you years ago. It's like that wasn't cool, but even I asked you before this podcast, is leaky gut, is that something that's acceptable in your community? And nowadays, yes, I think it's mainstream. People know that low-grade inflammation. Tell me your thoughts on leaky gut. I mean, do you see that as a GI provider, and do you think that is an issue?
So leaky gut in my world is called intestinal permeability. And I think, there's some practitioners who will hear leaky gut and immediately dismiss it. But when you think about it from a standpoint of intestinal permeability, it actually is a very real process that occurs. And that means that instead of the lining of the gut being very tight, where you have tight junctions between the cells, the junctions are now disrupted by something, whether that's a bacterial process, or whether it's actually a food allergen or a food stimulus, or some sort of other irritant that meets the surface of the bowel. Could be in medication like anti-inflammatories that disrupt the cellular junctions. And once you disrupt those junctions and you create a gap between the cells, now you have what we call intestinal permeability. And now everything that goes through the gut is seen by the immune system, and the immune system tends to overreact to these things. It could be something harmless, but the immune system is triggered to respond. And now you've just created an autoimmune process where the immune system continues to fight against the lining of the intestines because it saw something it didn't like. And now you've got this uncontrolled process of inflammation on the gut surface. If this doesn't get controlled, we are going to see a lot of other autoimmune conditions. And this is where we think Crohn's and colitis begin. It begins with a disruption of the gut barrier. And I've also seen, multiple other autoimmune conditions coexist in this situation of intestinal permeability, whether that's arthritis, where we're now affecting the joints, or whether it's skin conditions. There are a variety of different things that keep.
Got it. That's like you just mentioned NSAIDs. There's a lot of drugs that cause this. There's certain foods that are bigger drivers. And I will just tell you, as a pharmacist working with patients, I see stress as a huge driver. There's a lot of feedback mechanisms where it makes that gut lining fall apart. Things get through, and all of a sudden the immune system is forced to react to things that it shouldn't. Do you have, what is your, if you've got somebody that you suspect that with, what are your favorite kind of protocols to help seal that gut up, to help maybe reduce, obviously eliminating the foods and the drugs, but do you have any kind of protocols you'd like to help seal or fix that gut lining?
Yeah. So I think, as you mentioned, you really have to take away the trigger. So if you can remove the trigger that's creating that surface inflammatory process and permeability, then that's really number one. And number two, I do tend to use bovine immunoglobulin quite a bit, and I've seen a really beneficial effect. I feel like, there's definitely staging. You have to make sure that you're removing the offender, and then you're sealing the gut lining, because otherwise you may potentially not get the effect that you're looking for. But I do tend to use bovine immunoglobulin.
Very good. We couldn't have a gut discussion without talking about probiotics. Okay.
Yeah.
So what do you see as the biggest misconception with probiotics out there right now? Obviously, probiotics are a huge market. And I think in mine and your lifetime, I think there's going to be prescription precision probiotics to treat medical conditions. There's no doubt in my mind about that. I said that 10 years ago. It's not here yet, but it's coming. But what do you see as the biggest misconception with probiotics nowadays?
I think the probiotic world is just crazy, and there's so many options. And I think people really get confused about what probiotic to use. And even sometimes I'm confused. I don't know, is this the right probiotic for this patient, or is this the right probiotic? So I think as we learn more about the role of probiotics, probably can do a better job at tailoring which strains of bacteria really will benefit which patient type. There are certain instances where I do recommend probiotics, and this is in the patient who may have, antibiotic use, for example. This is a situation where you're getting bacterial effect on every strain of bacteria in the gut, whether it's the ones you want to target or not. And so there may be some value to using a probiotic along with antibiotics like Akkermansia colitis, for example. We also have in the conventional GI world, we do have some data on use of probiotics in conditions like inflammatory bowel disease. So there are some studied probiotic strains that are helpful in either achieving remission or maintaining remission when it comes to Crohn's and colitis. So we do have our favorites there. So I do tend to use that. I also tend to use it for repopulation. So if I'm looking at a patient who has bacterial overgrowth in it, and I've resolved that issue and I'm trying to put good bacteria back, there is a stage protocol that we use good bacteria to repopulate the gut. I do like spore-based probiotics. They tend to be more resilient. They tend to be able to do a better job at achieving the results that we.
Yeah, that's great advice. Because the probiotic world's crazy right now as far as that goes. Now I'd like to put you on the spot with this one. What's your thoughts on supplementing with Akkermansia? That's super popular right now.
Become a favorite of mine. I actually have used it in patients who are on GLPs and finding that it does help to, and patients who are overweight, I think we can pretty much say based on studies that they may have low levels of Akkermansia. And so this is where the Akkermansia probiotics, I think, can be very helpful. We also know that Akkermansia specifically has a role in protecting the gut barrier, the gut lining. And so patients who may be have disrupted gut barrier function may also benefit from Akkermansia. So there are some tests that I use to look at Akkermansia levels in microbiome analyses. And so if I see it there and it correlates with my clinical picture, then I will recommend it.
Very cool.
I also use food to promote Akkermansia. So there are certain things dietarily that can be helpful in promoting Akkermansia as well.
Yeah, I've heard you talk a lot before about use of polyphenols and those type things to drive short chain fatty acid production, which basically, like I always say, it's like the fertilizer or the rocket fuel for that gut lining. Because if you don't have that, you're going to really struggle as far as that goes.
Absolutely.
If you had 3 things you could tell someone to change their gut health today for the better that you've learned through the years with all the stuff you've done, what are those 3 things you think you would say, hey, focus on these 3 things and you can totally change your gut?
Wow. Yeah. So I think the first one that comes to mind is food. So let's cut out the processed foods, all the different food additives. Look at what you're eating. Try to, as much as you can, prepare your food and from fresh ingredients and stop using all the preserved products. I know within our busy schedules, that's not always easy, but if you can minimize it, that would be helpful. The other thing is really going to go back to stress. And we talked about this at the very beginning. So if you can find ways and outlets for stress management, I think that could be immensely beneficial, whether that's meditation, yoga, exercise, whatever that may be. And then lastly, sleep. So getting a good 7 hours of undisturbed sleep, which even for me is challenging. So I have to actively find ways where I can actually do that. And I think if we can manage those things, then the other things become a lot easier.
Very cool. This has been awesome because, like I said, the gut is so powerful. If people want to learn more about you or get information about you, where do they find that?
If you Google Katie Integrative Gastroenterology, we should pop up. Of course, you can always Google my name as well.
Very cool. Like I said, she is my go-to. If I have patients with GI issues, unfortunately, they get given her number as far as that goes. So I just really want to thank you so much for bringing clarity to this topic that so many people, they struggle with on a daily basis. And if you're listening and you've been dealing with like gut issues for years, I hope this episode really reminds you that these symptoms are real, but there is healing that's possible. And I want to thank you for being here today with me. And we hope this gave you some hope and pass this along to friends and family. Be sure to share this episode because gut health is something that is so important, but if it gets ignored, can affect everything else in the body. And like you said, I'm super grateful to have you, Dr. Tamarisa, on to share this information with our community as far as that goes. And for all of you out there, like you said, thank you so much. Keep searching for the truth about how the body works. Have a great day.
Thank you, Steve.